In this scene, of course, this is a transabdominal ultrasound, pelvic ultrasound, and I'm using the probe, the abdominal probe. And as we know that there is a landmark in the screen, as we mentioned before, that you should have the screen landmark towards the left side, as you can see here. And of course, that corresponds to the probe in which you are using the probe. I mentioned that before, that when you're using the probe like this here, okay, when I'm using the probe, we should have a landmark on the probe towards the head of the patient, and that landmark is corresponding to that landmark in your screen. So when you are using the probe longitudinally suprapubic on the patient's pelvis or the pelvic area, so that would correspond to the anatomical position in which you should imagine that the head is towards the left side and her legs is towards the right side. And so this is a longitudinal section or a sagittal section of the uterus. As you can see here, this is the uterus, and of course that full urinary bladder is very important because it acts as an acoustic window or acoustic appearance of the uterus, and that acoustic window helps us markedly because that's a very good acoustic window for ultrasound. The uterus is seen, and you can see something in the cervix, as you can see here. And because she had an intact hymen, so we cannot do a transvaginal sonography, and that's why actually I'm using the transabdominal only. There is something inside the cervix here. If you focus and you can see this, there is something inside the cervix here, and of course that is suggestive of myoma. And of course also that girl, or that, you can see this is the myoma, okay? Of course she complains of excessive menstrual bleeding. So that's how the cervical myoma is appearing. Very important to assess this myoma and to measure it and to follow up the size of this myoma, because unfortunately the increased size of this myoma progressively is compressing the ureters bilaterally and may cause or end by hydronephrotic changes of kidneys.